Hi all, I'm Angela Drent with Siouxland District Health Department. Today, I'm going to be providing updates on how two local medical clinics are improving accessibility and reducing barriers to improve access to preventative care services. We ended up working with Mercy One Endocrinology and Infectious Disease Clinic, as well as Mercy One's Singing Hills Family Medicine office. What we did is we completed on-site CHI assessments at both locations. We did complete surveys with patients as well as with staff, or had conversations with staff on barriers to accessibility and serving individuals with disabilities. And then we kind of gathered and collated that information and provided recommendations back to both locations, and then helped provide some technical assistance to complete program, policy, system, and environmental changes. The survey results, so the surveys that we did with the staff, they did report that their patients did not experience physical barriers either entering or navigating through the facility. They did experience some patients who had issues with checking in using the tablets, mainly due to visual impairments. They did express a need for a wheelchair scale and a lower height or accessible exam table. And they also reported that most of the accommodation requests that do come from patients were for either American Sign Language or accommodations for wheelchair users. The patients themselves, we did have them identify disability type. We found out that 5% of patients at the endocrinology and infectious disease clinic identified as having some sort of a disability, and 11% of patients at the family medicine clinic at Singing Hills identified having some type of disability. And the most common types of disabilities reported were either hearing or visual impairments. None of the patients who completed the surveys indicated that they had issues navigating through the clinics. Some of them did report some difficulty either using the tablet to check in for their appointments or the online patient portal. We did have a couple of requests from patients either for large print or alternate methods, and then also a lower exam table. Some of the best practices that were identified at both locations were accessible parking, having automatic doors for entry. If the doors were heavy within the facilities, those doors are typically propped open. The pathways were wide enough and significant for individuals with mobility devices to navigate easily. The signage in both of the facilities were high contrast and large print for the most part. The scales at both of the facilities did have grab bars by them, and accessible bathrooms were marked appropriately at both clinics. Some of the recommendations that we did provide to the clinics were asking patients if they had any types of accommodation requests prior to their appointments, and then fulfilling those requests so that they were prepared and ready for those patients when they arrive for their appointment. Having lower check-in areas or offering clipboards for patients to be able to fill out paperwork when they come in, having companion seating in waiting areas, having wheelchair scales available, simply moving items such as storage containers and garbage cans out of the pathway and bathrooms to make it more easily patients are more able to easily navigate and move through the restroom, having adjustable height exam tables, having transfer boards available, sensory-friendly exam rooms, maybe with light switches and other sensory-friendly items available, having a flexible tape measure on hand for alternate height measurements, having lever door handles instead of knob handles, assistance available upon request signage, as well as having then large print documents, mainly for check-in and any patient education, and then communication cards, having those available for patients who may need them. Quick summary of some of the changes that the clinics did complete. They did add assistance available upon request signage. At both locations, dimmer switches were added to one room in each clinic. Both clinics now have transfer boards, as well as wheelchair scales. The endocrinology and infectious disease clinic did have a portable wheelchair scale available already. So they did add one to the family medicine clinic at Singing Hills, and they now have communication cards available. Here's a quick look at the communication card. It's just a free download from Widget Health, and a look at the new wheelchair scale. A simple fix is really just moving, like I had said, the trash cans out of the way. You can see the large one on the left-hand side is right underneath a paper towel holder, which would potentially restrict access to that in the sink. So it's just replacing that larger garbage can with a smaller garbage can, and moving it out of the pathway. Another before and after look is a lobby area. Simply just removing a chair creates a space for companion seating or individuals who are using mobility devices. And here is our contact information. So if you have any questions, feel free to reach out to either myself, Dawn Kimmel at Simcoe, or Barb at Mercy One. I thank you and look forward to hearing from you if you have questions.